The next part of our program, which will tee up in just a moment the CSIS Zambia video. Immediately following that, I'll introduce Ambassador Mark Storella, U.S. Ambassador to Zambia, to offer some remarks on that process and the product and the context in which we made it. And then I will turn to our other guest, the Deputy Ambassador from Zambia to the United States here, Alfred Chiozza. The work on this video began in earnest in October when we opened a dialogue with our embassy in Zambia and with the Zambian government. And our team went out for about 10 days in November, and they've been working quite assiduously on finalizing this product. Since then, it was posted this morning on the CSIS website. So today's really the launch, and we're using this occasion to launch this. So please, if we could tee that up and watch the video. Thank you very much.
It is very important that we see development as a human development. It's not that we should have tall buildings. It's not that we should have only nice roads on which we can travel. It is above all that we develop the human beings. And if we are going to develop human beings, it is logical that we see development as starting with what we do with the children as they are born. It is through vaccines that we have been able to protect the health of the child.
In 1980, only 1/5 of the world's children had been vaccinated. Today, 80% of children are vaccinated by their first birthday.
It has long been shown that vaccines are a very important tool in fighting infectious diseases because they not only protect the child immunized, they break the transmission cycle.
Chimpanze na chiwa chumwana nje muchingirire kumalwele ayalikanalekana kwe wachinganwa ule omuti abe wachingizwa na ngoma lwele yalishirete chieka.
The World Health Organization estimates that routine immunizations have saved more than 20 million lives over the past 2 decades.
Immunisation really is sometimes described as the backbone of health services. It's a source of access for women. Women bring their children in to be immunised, and then it's a point where they themselves can also receive health care, health advice, advice about family planning, etc.
As one of the most important and cost-effective tools to increase child survival, vaccines are a best buy in global health. In 2011, the international community reaffirmed its commitment to vaccines, pledging an impressive $4.3 billion through 2015. The importance of these commitments can be seen in Zambia, a country with high rates of maternal and child mortality that illustrates the opportunities and the challenges of immunization in developing countries.
I'm a parent, many people are parents. We've all had the experience of seeing your child get that shot in the arm. There's a long chain leading up to that shot in the arm. It starts with the scientific work to develop the vaccine. Then there's work to develop the infrastructure of health, clinics, trained people, even trucks that move vaccines that are cold around a country that's hot. And then when you get there in that clinic, you need somebody who not only can apply the vaccine, but can document it properly.
Getting vaccines to the children who need them is no easy task, and the obstacles start with research and development. From the laboratory to the clinical trials to quality control, the development of a successful vaccine requires, on average, 12 years and millions of dollars before it can be mass-produced and distributed. When vaccines arrive in a country like Zambia, they must be distributed to individual clinics throughout the country by trucks, motorbikes, and bicycles, often over long distances and unpaved roads, even during bad weather and fuel shortages.
We as Mukushi district, we also have the hard-to-reach centers. The furthest health centers in the Luano Valley is about 315 kilometers. So it makes us very difficult as a district to do the activities of child health effectively.
Most vaccines that are used today need to be stored at refrigerator temperatures. That's pretty easy to achieve in a country like the United States, but in some countries it's very difficult.
You know, Zambia is a huge, expansive country, such that in certain places you may not actually have, say, electricity.
We make sure that we carry enough ice packs so that we maintain the cold chain.
Just as it is difficult to move vaccines around Zambia, it can be a serious challenge for women to reach health facilities with their children, especially as many must travel by foot.
We've got a huge geographical area with very few people in it. The topography is difficult to navigate, the road infrastructure is lacking. And often people really don't have very regular or frequent contact with the health facilities.
Transport achinshupa so nachikongora shepa kuisa. Chachirenga chicheru kuisa. Kachipota nchitapa kuera moto kayachira isura.
Furthermore, a severe shortage of healthcare workers limits the health system's effectiveness.
And of course, some of the health centers, the staffing levels are very low.
I would give an example of in MCH where I am. There are only 3 midwives against the entire population of Kanyama. Say per day we do have 399 babies coming our way, whom we have to give vaccines per day. All the services under one roof against the 3 midwives.
In addition to addressing these challenges, increasing access to immunizations requires engaging communities. Misinformation and rumors can undermine trust in vaccines and keep parents from immunizing their children.
Specifically, one might say, if the community is not itself a participant in these activities, there is no chance of succeeding.
You know, public trust is difficult to gain, but it's very easy to lose. And trying to rebuild it is a major challenge. It's really important that we pay attention to the community concerns and understandings as we roll out the new programs.
Before we start the actual date for immunizations, we go around sensitizing our community. We use the megaphones, also we use in the churches and our stakeholders to hold meetings so that when they go out, they give information to our mothers and the community at large.
Zambia is also preparing for the introduction of new vaccines, which present new challenges.
When, in fact, the health system struggles with existing interventions, to bring on new vaccines is an additional load. So as we introduce some of these new and good things, we need to also bear in mind that we are stretching further.
A wide variety of international partners is helping Zambia on this range of challenges. At the center of these complex relationships is the Gavi Alliance, a global partnership that helps buy vaccines for disadvantaged populations.
Yes, Gavi is what we call a public-private partnership, and it's been going for 10 years, and it was set up in the year 2000 with a specific mission of saving children's lives and improving people's health through increasing access to immunisation, which of course is about the best value for money you can have.
Conditions are attached to Gavi's assistance. For a country to receive vaccines from Gavi, its national income must be below a certain threshold, and it must make a co-payment and prove that it can meet the requirements of distributing vaccines.
And this is important for a couple of reasons. First of all, it makes it a partnership, because if the governments and the countries themselves don't want the vaccines and don't value the vaccines, they're never going to be sustainable in those countries.
Although the Zambian government has worked closely with Gavi and other international donors, there have been concerns about financial accountability in the health sector. Reports in 2010 suggested that the Zambian government mismanaged $8 million from the Global Fund to fight AIDS, TB, and malaria.
Some of the donors have recently held back their support on account of governance issues. But the present government is moving very speedily to try and iron out those issues and to ensure that at no time do the donors have caused to think that they are misplacing and misallocating their resources.
We accept responsibility for the core support of the programs, but also appreciate very much the support that we are getting from our partners.
Despite these challenges, and even in a tough global economic climate, immunization continues to draw high levels of international support. In June 2011, representatives of 20 countries joined foundations, UN agencies, and the private sector to raise money for the Gavi Alliance. The United States pledged $450 million over the next 4 years.
The U.S. government approaches immunization both at a multilateral level and at a bilateral level, at a technical level and at a policy level. So at the multilateral level, it very much is through organizations like WHO and UNICEF and Gavi as an alliance for all immunization partners. But we also think it's very important for us, with our presence that the U.S. has on the ground, to be working very closely on a bilateral basis to ensure that governments and other national stakeholders have the kind of support that they need.
You know, there is really a question when we're facing such budget problems in the United States as to how we can be sure that we're getting what we want. The American people and Congress have shown that they want to save lives, and they're particularly focused on children and mothers overseas. And if we can show that we can do so in a measurable way, the American people will be generous in supporting those efforts.
We're so close to eradicating polio, and we have a chance to reduce pneumonia, severe diarrhea, and even cancers like cervical cancer.
I would say that there is no price for life. Children die because they have no access to a vaccine that costs $5 a child. And I think that it is a small price to pay, because then we have a healthier world. And so we can, in future, focus on other problems, investment and development, rather than battling disease for centuries.
Thank you all, and we are very grateful to the U.S. government, to our embassy in particular, and to the Zambian government, and we'll be hearing from the ambassador and the deputy ambassador momentarily. I also want to say how grateful I am to Janet Fleischman, Seth Gannon, Emma Curran, and Julia Nagel for putting this piece together and being so committed to it. Mark Starella has been our ambassador since the end of August of 2010 and brings really an exceptional background to be an activist ambassador on many fronts, including and very importantly in the global health area. Prior to coming, he served for 3 years in Geneva, initially as the Refugees Affairs Counselor, which of course put him into very strong day-to-day interactions with UNHCR and the International Committee, the Red Cross, in all of those areas, health being very integral. Thereafter, he became the Deputy Chief of Mission in Geneva, and the portfolio broadened to very close-in interactions with the major multilateral instruments, the Global Fund, the Gavi Alliance, the World Health Organization, and others. And I think that he's a terrific choice and a terrific example of what has happened in the changes in our diplomacy. If you look at Africa, just as an example, if you look at what has happened in the last 10 years in terms of activist and highly motivated and highly skilled ambassadors who have become leaders as chiefs of mission in mobilizing our embassies around a very smart health engagement, it's quite a record, and it's reflective of several big changes. But just look at Zambia itself. Don Booth was there before. He's now in Ethiopia and doing a great job. Martin Brennan was there before in Uganda, both highly skilled, highly committed on global health. You look in the region, Michelle Gavin in Botswana, Don Gibson, South Africa, Scott Gratian in Kenya. These are all ambassadors that bring considerable experience and, most importantly, commitment on global health issues, and they have taken up the charge about leading the embassies as the front edge of U.S. policy. This has become ever more important. The expectations are that the missions will become the front edge and will be leading and will be bringing about much more integrated and forward-looking approaches. In the Zambian case, I'm sure we'll hear from the ambassador, our health portfolio, our budget commitments, our ongoing programs are the central facet of our bilateral relationship. Much of this also draws upon the power of the personality of the people in question. The people I've cited, including Mark, are people who bring an innate passion to these issues and a sensitivity, and they migrate normally and quite naturally into these areas. So please join me in welcoming Ambassador Mark Starella.
Okay, well, good afternoon, everyone, and I want to say that I'm really delighted to be here. Steve, thank you very much for that kind introduction. I really want to express right away my gratitude to CSIS and, of course, to the Health Policy Center, the Global Health Policy Center in particular, but also especially the government of the Republic of Zambia and Dr. Joseph Kasonde, whom you saw there, the Minister of Health. They really went all out to make this effort possible. Steve was talking about what ambassadors do nowadays and how we get engaged. And frankly, we spend a lot of time on health. And sometimes you get unexpected results. I once went to an opening of a whole bunch of USAID projects focused in my remarks on convincing couples that they should be tested for HIV. And I urged that everyone should be tested for HIV. And when I finished, I came down and they said, okay, well, we have all the tents here. Would you like to be tested for HIV? And so there I stuck out my finger and got tested. Then I went to another one out in Eastern Province in Chapata. Do you remember this? Alfred Chiosa, the Deputy Chief of Mission here. And I gave another pitch on another very important medical intervention that was very important. And when I came down, the doctor in charge said, well, you urged everyone to do this. Are you ready to have a medical male circumcision right now yourself? So I want to say that coming to a film festival about health is much less threatening than some of the things that your ambassadors are called to do. In Zambia, we have a very large and very active embassy. And most of you are American. I know not all of you are American. But I want you to know that our bilateral assistance effort in Zambia is quite significant, nearly $400 million per year for Zambia. Of that, 85% is focused on health. 40% of my staff at that embassy, whether it's USAID or CDC or State Department or DOD or the Peace Corps, about 40% of those people spend every day working on different aspects of the health challenge in Zambia. This group knows very well how good an investment health is. Vaccines are so importantly and so clearly a preventive investment that pays off not just in saved lives, although it does do that right away, but also in economic benefits for a country like Zambia that needs its young people to survive, go to school. It needs mothers not to have to be spending all of their time taking care of sick children. And frankly, the heartache that comes from dealing with the loss of a loved one. I don't know how you measure that, but it can drag a country down. From the perspective of the United States, I think that the American people very much feel that first, from a humanitarian perspective, this is a good investment. We want to save lives. I think that also it's very well understood that diseases know no borders. In many respects, what we do to protect health in a country like Zambia ultimately protects the health of the American people as well. But I would go even a step further and say that many of the health challenges that we face have the potential to undermine the fabric of society. If we look back at what was happening at the height of the HIV/AIDS epidemic, the number of people who are dying, the number of teachers, the number of doctors, the number of policemen who are dying every day, we could have had a real threat to the fabric of society in southern Africa. And that becomes even more than a health issue. It becomes even a security issue ultimately. So these are very, very important investments. But we know that money is limited. There's tremendous pressure out there. So with that as the background, when we heard CSIS and the Global Health Policy Center wanted to come and do a video on vaccines in Zambia, we were all very excited. And I told the staff, please do what you can, open every door you can. I was very, very interested in hearing the presentation by Dan Green about telling the stories. Dan, where is Dan here? Somewhere back there. It's very, to me, compelling. How do you maintain support for these very expensive programs? And it's clear you have to reach not just a bunch of talking points that interact with certain people intellectually. You really have to touch people's hearts. And as we're seeing here, and I really am enjoying this, there is art involved in this. This isn't just policy. It isn't just a bunch of spreadsheets. It's really making a presentation that's very compelling. In Zambia, we have so many people engaged. As I mentioned, we have USAID and CDC and the Peace Corps and DOD and the State Department. But we also have, of course, many other partners, Gates being a very important one, the Clinton Foundation being an important one. But one of the things that I really like about what was produced in this video is indeed that it tells the story a bit of some of the individuals in Zambia, the Zambians, who need our support, who themselves are really critical heroes in making real health progress possible. Dr. Joseph Kasonde, he's a friend of mine, and I like him very much for a lot of reasons. He came out of retirement to take this job. And when I've spoken with him about it, he said to me, you know, I had the opportunity as a young man, or younger man, he's pretty old, so who knows, to participate in the eradication of smallpox. And that is something that for my whole life I feel was worth doing. I want to help eradicate other diseases. He's really dedicated to it. And what we saw in the way this video was shot is that in a country like Zambia, especially with a new government, I think you all know we just had elections in Zambia and a change of government, peaceful change of government through a democratic process. People are vying, just as we vie here inside the Beltway for dollars. People are vying there for dollars and for priority in a new government's platform. And Dr. Kasonde is out there doing that, working for that. He worked very hard in 1 year to increase the health budget of Zambia by 45% in 1 year. And as we're looking, I mean, that's quite an extraordinary thing. As we're looking ahead, I think always when we look at places like Zambia, we have to recognize that our support's critical, but in the end, it's going to be the strength of the Zambian government, the commitment of people like Dr. Joseph Kasonde and the doctors you saw from CIDERS in Zambia to move forward. I think this story that you've told, which I think is told in a really nice and compelling way, it helps. Initially, Dr. Kasonde was a little nervous, and I know Janet knows this very well. It was hard to get clearance on things. They were being very, very careful. They don't know whether or not this kind of a story is going to cast them in a bad light one way or another. I think some very interesting questions already been raised that I've heard about the dangers of that, of inadvertently casting people in a country like Zambia in a light that they wouldn't want to be cast in. I don't think you did that here. I think you really show great strength. So what I want to say as my final message to all of you is that this telling of the story this way, using this kind of media, it's going to help to create support for medical interventions and vaccines in capitals like Washington, where money will be voted. But equally important, it raises up people like Dr. Kasonde, the Zambians who are on the front lines. And in the end, I think they're the ones who are really going to make the difference in success by making these kinds of campaigns possible. So to CSIS, I want to thank you very much for permitting us to participate in this effort and wish you all very well. Thank you.
Thank you, Ambassador, and thank you to your other team members who were so critical, Priscilla Sanchez, Susan Brems, Stephen Schwartz, and many others. We were very reliant here in Washington upon the goodwill and the guidance that Ben Kongwa shared with us over the course of this. And Ben, I want to thank you so much for all of the help that you provided us. We had many moments where we needed your guidance and your advice, and you were very generous in providing those to us, and thank you. I'd like to ask the Deputy Ambassador, Alfred Chiozza, to come forward and share with us some of his thoughts. Ambassador.
CSIS officials who convened this, I guess, American Ambassador to Zambia, Ambassador Mark Storella, distinguished participants, good afternoon. It is humbling, I must confess, to sit there and watch the stories that people who have come from America, Europe, tell about Africa, and Zambia in particular. It is touching, I must confess. Before I say my short speech to you, or my message to you, let me start by, sharing, an African proverb with you. I'll say it in my language, which is Eastern Province, where they asked certain things to do, where they wanted to do certain things to the ambassador. Ati nyumba ya mzako ngati yapya mutandize kumuzimira. I'll translate it. If your neighbor's house is burning, whether it's grass thatched, go to his aid. I think the moral lesson that comes from that is, I think, empathy and philanthropy, which you Americans, I must say, without any reservations, know how to do very well. We are very grateful. Indeed, it gives me great pleasure to stand before you, distinguished guests, to deliver a short but very important speech on vaccines in relation to my country, Zambia. You are very well aware that Zambia faces so many challenges, so many, among which are health challenges. And what you people are doing, the initiative that you people are taking, the intervention, really goes towards, alleviating these problems. You do appreciate too, I know you are well learned, you research very much, the lifespan of an African, a Zambian in particular. The measures that you undertake really help to ease the problems that we people face back over there. Zambia highly appreciates the assistance of the United States of America in the health sector. You will recall that not long time ago that the Secretary of State, Hillary Rodham Clinton, had the pleasure of visiting the University Teaching Hospital when he was on a AGOA mission in June last year. And she took the advantage to visit University Teaching Hospital, our biggest and referral hospital, just to share ideas and discuss with the hospital. She visited particularly the pediatric center to see how they were improving the health issues within the country. You will also recall, ladies and gentlemen, that it was not long ago that members of the Zambian embassy had come here again to watch a short film regarding the vaccinations that are taking place that you do in Zambia. And once again, you have invited us, Ben and I, to come over here and to participate and watch yet a complete 10-minute documentary of vaccines in Zambia. It is against this background that we wish to thank the many people involved in the production of this video, which will be shown on our national broadcasting station on what is going on regarding vaccination in Zambia. In particular, we would like to thank the Center for Strategic International Studies, CSIS, for the well-thought, well-produced documentary. We also would like to take this opportunity to invite CSIS to continually help Zambia overcome the health challenges which we face. I can assure you, ladies and gentlemen, you know very well we have many more challenges, and we look up to you. Thank you so much.
We're going to move straight into our next panel. So I'd like to invite our panelists to come forward. Thank you.
Hi, thanks again to CSIS for hosting us. My name is John Donnelly. I'll be moderating the second panel. I'd like to move as quickly as we can into the discussions here. One thing I do want to point out from what the Deputy Chief of Mission just said, I thought it was very important, was that this video be shown on national TV in Zambia, which was a question I had about how that was going to actually have some impact in Zambia. So I think that's a great achievement that CSIS has done for that. And one other observation from listening to all these talks that I have is that we've seen these amazing videos. I think they're home runs, or they'll make people like me cry. But I also think that what Steve said in the beginning about how videos can be used over a broad range of products is very important, so that they don't always have to be these amazingly produced videos that we've all seen, but they can be real short videos. I mean, Amy Batson, who you'll hear soon, has done a number of videos, short 1-minute videos. She was shown in this one, that can be very, very effective. So I hope this is empowering to you and to think of many different ways of using videos. And one other thing about this video that we just saw was that it did raise a very touchy issue, and it mentioned corruption in Zambia, which I think is something that a lot of advocacy groups, you're not an advocacy group, but advocacy groups will try to steer away from. So it was interesting to see the treatment of that in this video. So without further ado, I'd like to introduce the producer of the film, Janet Fleischman, Senior Associate of CSIS Global Health Policy Center. She focuses on women's global health issues, including HIV/AIDS and reproductive health. Janet.
Thanks, John, and thanks all of you for coming. We were really excited to be able to be here with the other organizations and be able to have this sort of film festival, not the kind of session we usually do, and it's been really great to work with all of you to make this happen, so thank you all. And also, before I continue, Steve has said it, but this was really a team effort, and Emma Curran, our videographer, Seth Gannon, and Julia Nagel, who's not here, really have been working very hard and bringing all their talents and creativity and great flexibility in making this work. So thanks to everybody for making this happen. At the beginning, Steve touched a little bit on why would CSIS be making videos? I mean, it's obviously a think tank. It's not an advocacy organization. And this issue that's come up in so many presentations, how do you present complicated issues in a short video? I mean, ours is relatively short. We would have wanted it to be longer, but it's as short as we could make it for now. How do you do that in a short, digestible format and keep to the authenticity that Dan talked about and the credibility? Our challenge as a think tank was to focus on a different type of video, to try to explore the issues, to try to go deeper into the content, the analysis, the U.S. policy pieces, and then to see if that's going to resonate with audiences and if we can then link them with our other products, the important reports we released in December about vaccines and immunizations globally, the other content we have on the website, the Facebook, the Twitter, can we launch information to people? Can we make it accessible to people in a way that will be useful to them in the way a think tank's information is useful, so to guide policy and options and information to the American public? Steve talked about how this started out in 2009 with the Commission on Smart Global Health Policy. So it is really relatively new for us to be working in this arena. And the other piece that we've been doing is these small screen sessions. So interviews with experts that get put up on the web, including on the Kony video most recently. And also we, like this is being webcast, so the meetings that people outside of Washington can't make, or people in Washington too busy to make, can watch, and as a way to be able to extend the reach. The Zambia video obviously is a different take. It was really an effort to bring content in a much more compelling, engaging way, to bring in the local realities, the local voices, and to show the context for the policy decisions that the U.S. is going to be making, the international community, the Zambian government itself, and to present the stakeholders in that. We were trying to balance making the case for vaccines while highlighting the challenges and presenting some analysis about that. So you saw some footage about the issues of training and huge complexities of human resource constraints, the logistics of actually just getting to places, and the roads and the infrastructure, the cold chain, which can be described maybe best by seeing that little cold pack with the cooler, and you realize how far that had to come from the capital to get there. It's quite extraordinary when you think about keeping vaccines at a certain temperature. We also really wanted to see this as the importance of immunization as an entry point for other services and information. So we talked a little bit about the importance of this as an entry point for women, for the mothers who are bringing their children. Given the difficulties of often getting to these sites, how can it be a way for them to access other health services, other information, family planning, other reproductive health issues, HIV services? It's a big challenge, but it's a critical entry point. And we talked, of course, about building public trust and engaging communities. You can't say enough about that. If the communities are suspicious, if they don't have information, if it's not coming from sources that they trust, then why would they let their children be vaccinated? I mean, it's a huge piece of what has to happen. And Dr. Kasonde mentioned it. The health workers all talked about it. It's a critical piece of it. And of course, we wanted to look at the issues involving international assistance, U.S. bilateral, the multilateral, other donors who play in this arena, and certainly this new funding mechanism, Gavi, which can get very complicated, but we tried to present it in a fairly short and crisp way. But also to conduct the interviews as we would for the policy reports that we do, but to give the viewers a sense, like an on-the-ground view of what's happening on the ground, to hear the voices of the people that we're talking to let them tell the story, from the mothers at these remote rural outreach clinics and healthcare workers who are telling how difficult it is to get to these sites, to the realities of the urban clinics and hospitals and the government officials, the Minister of Health, Minister of Finance, the U.S. Ambassador, to give people a sense of when you do these kinds of reports, this is the range of interviews that you do, and let them have a view on what that looks like. And then to hear that how the mothers say the challenges they face in bringing their babies, and the effort in traveling these long distances, the efforts made by the healthcare workers who have huge challenges in trying to perform all the services that they're asked to perform with such limited resources, and huge challenges, as we've noted, about the cold chain and maintaining the cold chain. And how lucky we were to be able to get the kind of interviews on film with high-level government officials, with high-level U.S. officials, so that people understand their thinking about how they make the case for health and vaccines as important to their country or in U.S. policy. So we really hope to use this tool to further explore how we can engage audiences in global health issues, and very importantly, to serve as a source of accurate and timely information. We try to link people from our website to our long, lovely policy reports that not everyone wants to read. And we feel very strongly about how important it is to control the content. We can't oversimplify. We have to maintain a certain level of analysis. And this was helped significantly by doing, for example, this video in-house. So we could go over and over and over again about the script and the message and the scenes. And clearly, as this panel and this day shows, there's different uses of videos for different kinds of organizations. And we're trying to figure out what is our space in that, and how can we be true to the kind of work we do, the kind of information we want to get out there, yet use this new tool in ways that push us in new directions. Obviously, the Kony videos show us how the huge potential to reach new audiences, and yet the care that has to be done in trying to tap into that. And finally, our challenge is going to be how to find ways to use these tools effectively to further engage the U.S. public in issues of vaccines and immunization and global health more broadly, an area where it certainly needs greater emphasis in the U.S. public. So thank you, and I look forward to hearing the other panelists.
Thank you, Janet. Next will be Dr. Nicole Bates, who's the Global Strategy Lead for Vaccine Advocacy at the Bill and Melinda Gates Foundation. She also coordinates advocacy work focusing on child health. Prior to joining the foundation, Nicole served as Director of Government Relations at the Global Health Council. And Nicole will talk a bit about just the foundation's perspective on what makes effective videos.
John, thank you so much. I'm really pleased to be here this afternoon. For those of us who have worked in Washington, D.C. on policy issues for a while, we're used to going to briefings and meetings, and it's usually a lot of talking heads and not a lot of video. So this is a nice kind of flip-flop of that. So I just want to congratulate CSIS for both this forum and bringing together also a new mixture of people to have a really important conversation about the issues that we care about. At the Bill and Melinda Gates Foundation, we work on a number of issues, primarily on global health and development, and then some specific work around education within the U.S. And within that entire portfolio, our top priority is vaccines. And specifically, most immediately and most urgently, we are interested in eradicating polio and finishing that very important job. Over the past 3 years at the foundation, each January, one of our co-chairs, Bill Gates, issues an annual letter. And in that letter, he gives his thoughts on the state of play, on the issues that we care about. And each year over the past 3 years, there's been a pretty notable section on vaccines and kind of how he thinks we're progressing and where he thinks we can go. And it kind of gives insight into where our energies are within the foundation, but also the direction of the community. In 2011, along with the launch of that annual letter, we released a video where Bill's voice literally was used to tell the story that he sees around vaccines. Again, both the progress and the potential. And we thought we would start today's discussion with a look at that video.
Saving lives is not easy. Sometimes we don't know how to prevent disease or death, which is tragic. But there are millions of lives we know exactly how to save. We can save them easily and cost-effectively with vaccines. I like to say that vaccines are miracles. They're miracles because giving children a couple of drops or a shot in the arm can prevent some of the worst childhood diseases for a lifetime. And that, to me, is a miracle. Measles is one of the most contagious diseases in the world. But just 2 shots make a child immune to measles forever. And each dose costs just 18 cents. Because of this vaccine, the number of children who die from measles has gone down from 2.5 million to less than 200,000 in less than 30 years. One of the greatest vaccine stories is playing out right now. It's the story of polio. Most people don't know that polio cases are down 99% worldwide. There are only 4 countries in the world where transmission of the disease has never been stopped. Those 4 are Afghanistan, Pakistan, India, and Nigeria. Only one disease has ever been completely eradicated. That's smallpox. And because of vaccination, polio is on the threshold of being the second. The polio campaign takes an enormous commitment. In India, for example, there are 2 million volunteers working in the fight against polio. Twice a year, they set up 800,000 vaccination booths around the country at schools, hospitals, and community centers. After that, they visit more than 200 million houses, one by one, Then they go to train stations, bus stations, and ferry terminals to put polio drops in the mouths of all the children. All that hard work is paying off. Just 41 kids in India suffered from polio in 2010. I feel confident that India will soon stop transmission of polio entirely. With numbers that low, it's tempting to say we've done enough. It's not worth putting in the enormous effort to take care of the last few pockets of polio. There are two reasons why that's the wrong way to look at it. The first reason is that it's impossible to keep polio at these low levels indefinitely. Over time, the virus would spread back into countries where it's been eliminated, like it did in Russia last year, and will go back to the days when polio was a terrifying threat for millions of families. We have seen that polio anywhere is a threat everywhere. The second reason we can't stop now is that finishing the job will energize the whole world around the great cause of saving children's lives. Big victories like eradicating a disease make us proud of what human beings are able to do for one another. And that pride inspires us to do even more. Vaccines save lives. They're the simplest, most inexpensive, most effective way to give all children a shot at a healthy, productive life.
So I'm going to take just a few minutes to talk about the Foundation's perspective on how we talk about vaccines and also some of the key themes when we're trying to communicate this to public and political audiences. For those of us who work in foreign affairs, international development, global health, we know that these issues are complex, and even the most seasoned of us find it difficult at times to come up with that ideal elevator speech, if you will, or that short 30-second clip to really get across the main points and the agenda and the action. What makes global health and vaccines even more challenging is the fact that the places where we're trying to do this work, for example, with polio eradication, the people and also the impact, it's foreign. And I mean that in the genuine sense definition of the word, meaning it is not local, it is not familiar. So even though the technology may be familiar, what we're trying to do and the impact we're trying to achieve does not seem immediate or most impactful on the lives of the people that we need to engage. So the first order of business is how do we make it relevant? And it's things like the videos that we've seen today, the analyses like what CSIS puts together, and then all of you who communicate this either as advocates or communicators or other experts that help to make it relevant. There are 7 or 8 themes that I will go through quickly that I think are really key to telling the story around immunization and vaccines that we found effective and that we are finding the community to be using, and it's our collective voice that helps to kind of socialize or mainstream those sentiments. The first point is that there is a strong history of success. Multiple people today have talked about the eradication of smallpox. 4 of the 5 world's children are receive immunization now, although we still need to reach that 5th child, as Tony Lake at UNICEF likes to say. And we also know that vaccines and immunization contribute significantly to achieving the MDGs. Before, there were 20 million children each year who were dying unnecessarily from before their 5th birthday, and now that number is down to just under 8 million, and vaccines have played a huge role. Secondly, that's a long history, right? That's taken 20, 40, 50 years. We've had some really recent gains and exciting wins, if you will. Folks have talked about the meningitis A launch in Burkina Faso in December of 2010. We saw immediately the impact in that season. Granted, it was a 10-year partnership that brought that to bear, but again, if you invest, then there are things like vaccines where you can see an immediate impact. And I am very pleased to say that the video that you just watched is out of date, right? India has just celebrated its 1-year anniversary of being polio-free, and that is a huge, huge success that we need to celebrate as a community and build upon. The third point that I would make is that we are on the cusp of even greater wins and bigger gains building off of these recent successes. Again, polio, We have 3 countries to go. We need to really kind of bear down and finish this last percent. We have new vaccines. Our friends at Gavi are doing a fantastic job of making vaccines for pneumococcal and rotavirus available to help reduce the deaths from pneumonia and diarrhea. And we also have an incredibly rich, almost bursting vaccine pipeline with malaria vaccines coming online, second-generation vaccines. So we're really just getting started. It's like the conveyor belt is coming faster and faster, and the question is going to be, is the world ready to kind of absorb it and make the most of the opportunity that's presenting itself? The next theme that I would mention is a concept called the Decade of Vaccines. At the World Economic Forum in 2010, Bill and Melinda Gates said, what would happen if we were to all double down our efforts in the areas of vaccine discovery, development, and delivery? We've come a long way, but where could we be in 10 years if we were to really focus? And he laid out a vision for that. And over the past 18 months, I'm really pleased to have seen the global community come together for the first time to have a dialogue across the enterprise, not just scientists talking to scientists or civil society talking to civil society, but everyone talking across the entire vaccine enterprise to say what's possible. And if we all, again, do our parts and leverage each other and maximize our efforts, we could see the eradication of polio, the elimination of measles. We could see vaccine coverage rates at 90%. We could see a number of new vaccines introduced, and that pipeline that is really rich, we could see it even richer and ready to do even more in the next decade. And that's very exciting potential. The next theme that I would mention is that of innovation. Innovation of what we do, how we do it, who does it. One innovation that I really appreciate is in the area of financing and really trying to figure out the best ways to make money available even when the economic climate is changing. And I'll get to that in just a moment. Another theme is the return on investment. We talk about vaccines. Vaccines save lives. They give kids an early start, a good, healthy early start. But there are gains that go beyond that child. They go to the family. They go to education. They go to economic earning potential. And there are additional analyses that are happening now that are going to give us additional insight into some work that was already done in the about 2005, 2006. So we're really starting to see that this is not just a case about health or global health or international development. It's about it's truly a global impact at all levels of the ecology. Something that I think we should flag, though, is that it's not all a good news story. It's not all clear sailing for us. And we need to realize that the golden age of global health, as many of us remember it in the early 2000s, it's kind of past, right? We've leveled off, still high investments by a number of donors and stakeholders, but we're not seeing that steep climb in terms of money or in terms of new programs that are being invented or new partnerships that are being brought together. There are global recessions. Traditional channels of money are increasingly scarce, but I think we learned an important lesson last year, particularly around the Gavi pledging meeting, which was a huge success, again, for the community. We know that there are increasing economies in the global south. We know that the BRICS countries are playing an important role and are transitioning from being recipients to donors. We know that there are reviews like the UK and Australia have done that show confidence in major international organizations like UNICEF and Gavi and others, so that we know when we do put money in, whether that money's limited, that we are going to get the best return on investment. And there are new markets, the Middle East, high net worth individuals, corporations, all sorts of areas. And again, innovative finance, where you invest now, you get your money now, and maybe you pay later, or you front load your payments. There are all sorts of really neat things that are happening. The last theme that I would mention is that of sustainability. A lot of times we identify issues and needs that we have as a community, and what happens is we get excited, we invest, we see some progress, and we say, great, and then we're on to the next thing. The one thing that I can guarantee you is that as long as children are born into this world, there will be a need for vaccines. So I see this as a very long-term agenda, and what we need to do is be smart in the way that we raise money as development partners, in the way that countries finance, in the way that our technology is made, so that we're really efficient and effective across all that we do, because this is a long-term play and long-term investment. What I would say in closing is that our opportunity as advocates or communicators is to really use traditional platforms, but a lot of these new platforms that we've been talking about today, figure out the best way to distill really complex messages not just into the champion or the person or the poster child, but to use that to open the dialogue so that we can then go back and have that next level of conversation to figure out exactly what needs to happen. You know, not everyone can travel to Zambia, but through videos like CSIS, we can bring Zambia to people who need to understand what's happening there, again, making it very relevant. The point is to make these issues that we care about incredibly compelling so that people are not just feel an emotional connection, but they feel compelled to act. And when they are compelled to act, that we have a very clear agenda for them to act upon. So with that, I'll turn it over and thank you for your time.
Thanks, Nicole, for that, the perspective of the foundation and vaccines. I'd like to turn to our third panelist. We've heard all about Gavi for the last couple of hours. Now we're going to hear from Gavi. Rhonda Stewart is the Senior Media and Communications Officer at the Gavi Alliance. She's worked as a reporter and editor in print and online media for news outlets including WashingtonPost.com and both of our favorites, the Boston Globe. Rhonda?
Thanks very much, John, and thanks again to CSIS for hosting this great event. I think it's so exciting just to hear the energy and the creativity around this type of event. So, thanks again for that. And yes, certainly we have heard a lot about Gavi today, and I'm really pleased to introduce a video that was shown at a pledging conference that was held for donors. This was in June of last year. And initially, this video was going to be part of a presentation given by the chairman of our board. But once the video was done and we saw what we had to work with, we decided to do something a little bit different and use it as a standalone piece. And I think part of the reason for that is video is obviously an emotional tool. It's a great way to tell stories, as we've been saying all day. And rather than making the case for Gavi and why it's so important to support vaccines and immunization, rather than doing that with figures or slides, this seemed like the most compelling way to inform people while also inspiring them. And so I'll pause there just so you can see the video and we can get a sense of it. Thanks. And ultimately we raised $4.3 billion at this pledging conference. So it was quite successful in financial terms. But I think that even more than that, it was just really successful because it really just continues to tug at people's heartstrings for some reason. I think one of the great things about that video is if you don't know anything about Gavi, it really gives you a great overview, not just of what we do, but why it is so important to support vaccines and immunization. And so we've actually done a couple of sequels of this video, and we've shown different versions of it at key meetings. We showed it last fall in New York at an event where Gavi was recognized by DFID and USAID in terms of progress made toward the MDGs. And we also showed it this year at Davos at the World Economic Forum. So we continue to think that this kind of approach and this way to convey information is going to be very useful and very powerful for us.
Great. we have time for questions. And there are many unanswered ones before. So raise your hand and we'll get a mic to you. Right here. Just introduce yourself and where you're from. Thanks.
My name is Claudius, originally from Ethiopia. One thing that I've been attending a lot of forums like this ones. But my wondering is like in terms of global crisis, the health crisis, I see that a lot of health workers, African diaspora who live abroad. And is there any efforts been done to utilize their resources or expertise into engaging those development efforts?
You know, one thing I will say a little bit maybe to the side of your question is that I do want to highlight Ghana as a really important Gavi country. And on April 26th, Gavi is going to be the first country we work with that will simultaneously roll out 2 vaccines. They're going to be rolling out pneumococcal vaccine and rotavirus vaccine. And in a few weeks, we're going to have a video up on our website, which is sort of a preview of that. And it's a bit of a movie trailer feel that looks at the question of everything that goes into being able to pull off that kind of effort. And so in that video, it's all Ghanaians who are working on the launch. So you don't have any talking heads from Gavi or anywhere else speaking about it. And it's really powerful just to hear people talking about what it's going to take to be able to do that and just their pride in being able to do that.
And I guess the only thing I'd add to that is that those networks of important skilled professionals who are here and trying to be able to engage with them and get them information, link into their networks with our information, get their information back to us so that there are ways that those connections can be made and hopefully that those skills can be brought to bear on the issues that are happening back home for them is something that is, of course, very important. And there are some groups that focus on that more than others, but I think the ability to get these kinds of connections between these networks are very important.
I think it would make a great video. Yeah. Ambassador.
Mark Storella again. I just wanted to add, many have probably read the New York Times Magazine over the weekend, which talked about a Zambian doctor who came to the United States for advanced training and ended up staying. One of the things we're doing right now, we have 2 programs, the MEPI program and the NEPI program. One is focused on physicians, the other is focused on nurses, and it tries to provide advanced medical training in their home countries, which is actually a good way, I think, of trying to keep these doctors who want this kind of training and these nurses who want this kind of training back in their home countries. You know, once you're overseas, you meet people, you fall in love, you lay down roots one way or another, and you may end up not going back. So I think MEPI and NEPI are great investments right now in trying to avoid medical brain drain.
A question in the back.
Yes, thank you. Rob Colorina at AIAC Investments. Had the benefit of spending a couple of years in Africa, mainly sub-Saharan Africa. 2 quick questions. One is, to what extent do you all work with or suggestions of liaising with the TMT sector? Because in this topic here, sort of on internet videos, you have many places where there's significant digital divide, where folks don't have, you know, that kind of access for this information. So it's the message as well, but you know, as far as delivery, you're going to run into significant inconsistency. Secondly, from the basis of pooling and going to the ambassador's earlier comments on his panel, as far as messages, how is Northern Africa sort of communicating with Sub-Saharan for the same message? And this may be more of a Gates Foundation question to effective distribution and coverage.
So maybe I'll start with the second question and then comment on the first. I mean, I think that you raise an incredibly important point, which is more broadly in your comments that these videos are helpful, they're universal, but they do not cover all interests and all audiences. And we do need to think about alternative ways to make this information available in simpler digital and media formats. You know, again, I'm all for innovation, a big champion, big fan of that. But I also think that our traditional media channels are still effective in certain markets, and we should make sure that this translates into those simpler formats. We've talked some about kind of mobile technology. A lot of these messages can still get out that way, and there are groups that work on that. To your second point about, North Africa versus Sub-Saharan Africa and otherwise, again, these are universal themes that we're presenting in these videos, and not we, just the foundation, but across the different panels today. But I would say that they do need to be tailored. And so whether it's local language or the local issue, whether it's a healthcare workforce issue or otherwise, those are things that we need to be sensitive to. That's why I do think that the Zambia video is particularly brilliant, because, there are universal themes, but there are issues that are specific to Zambia, so that when there is an action to be taken, that audience knows exactly what to do for impact for their specific market.
Okay, any other questions? One here, two here. Why don't we take both of them at once?
Hi, my name is Ashley Weatherford. I'm from the Best Shot Foundation. And first of all, thank you for joining us today to speak with us. And I have two questions. My first question is, I noticed in most of the videos there weren't really any action steps, subscribe here, donate there. And I was wondering if there was any sort of reasoning behind that. And my second question, I was a day or so ago, I was reading an article about how in Haiti they're having trouble distributing vaccines for the cholera outbreak amongst some sort of miscommunications and fears of the vaccine itself. So I wanted to know, in the countries that you work in, if you have encountered some sort of the same situation and what you've done about it, if it revolved around some sort of education program or something of that sort. Thank you.
Thanks, and we'll take the other question too.
Hi, I'm Rebecca Fields from JSI. And I just had a question. I think this would be for you, Nicole. I'm not sure. It's about competing priorities. There are many, many worthy challenges that merit resources. As we see immunization coverage going further and further up, we also have seen in the past that if it doesn't continue to get sustained resources, it will go back down. We saw that throughout the 90s. And yet there are very worthy competing priorities. So how do we continue to position immunization in a way such that it will garner the resources it needs to keep going while recognizing those other needs? Thank you.
So maybe I'll take a first stab at these questions. To the first one, you raised an interesting point. And so being in some of the planning meetings around videos, we have a back and forth about whether to include an action step and what level of action step that you can include. Depending on your tax status or affiliation as an organization, you can go but so far, and the types of actions that you can recommend are how specific, so that there's this balance between advocacy and lobbying, right? So a lot of groups, I think, when they create videos, try to balance that. But I do think that generally we could do a better job as a community of saying, okay, what do I do? Do you call your representative? Do you send $10 and it buys a bed net or it buys something else? So I think that's just an area of growth for the community, quite frankly, that we could use. So thanks for pointing that out. To your point about Haiti and some of the vaccine fears that are happening around cholera vaccine distribution, the issue of vaccine hesitancy is a serious one. It's happening in Eastern Europe. It's happening in parts of northern Nigeria. And there are a lot of strategies that we need to work on to address that. The first, from the foundation's perspective, is we focus on the value of vaccines. Taking on a loud and ill-informed anti-vaccine lobby is just not a strategy that we've chosen, but we do need to make sure that we are, as a community, equipped with the evidence, accurate information, and that we communicate that in a compelling way and just as loud and just as effectively as some of those other messages. Some specific strategies have to deal with working with local leaders, whether it's traditional medical healers or religious leaders, credible local champions who can help to correct some of that misinformation or some of the fears. I mean, you can imagine if you're in a remote part of the world and someone from the outside comes in and says, let me put this shot in your child's arm, and you're not familiar with that technology, there would be some hesitancy there. Even in more developed countries, though, there is hesitancy because of misinformation, because of what's happened. There are surveillance systems following adverse events, and it's really important that when there's a news story, for example, around HPV in India, well, why did those children die? Any loss of life is horrible, but we have to be careful not to associate it with the action of a vaccine if that wasn't the case, as it wasn't the case in that instance. To your third point, in terms of competing priorities, there are two schools of thought. A rising tide lifts all boats. But at the same time, then you have your camp that says you're robbing Peter to pay Paul, right? And that is just a struggle that we've had in the community, not specific to vaccines, but global health and foreign aid for decades. And one of the things with vaccines that we've heard today is that it can be an entry point into the broader health system. It's an indicator of the strength of the overall health system of a country. When you see a lot of these campaigns, whether it's polio or measles, a lot of times there are net distribution, vitamin A distribution. So if you're integrating your health service delivery, that can be a way to make sure that it's not just a vertical program or a single effort, because it's the same health worker, it's the same child and mother that need those services. So, I think we're well aware of that, and we need to think about the best ways to integrate. I will say that I think we've learned an important lesson from the malaria community, whereas I remember those days where there was this debate, well, is it bed nets, is it spraying, is it, treating pregnant women? And the answer is yes, yes, and yes, right? But what's happened is that the bed net kind of rose to the top as the poster child for malaria, and again, that might have been the public face or the public picture, but there's an entire agenda behind that. And that's why it's important to have experts and advocates and communicators that can then tell that broader story.
I would just add a quick word about the public trust issue, and it gives a good opportunity to highlight that you can go online and watch this on the CSIS or the smartglobalhealth.org video section. Heidi Larson from the London School spoke here about last summer, I think, about the building public trust questions and some striking examples of the lack of communication with communities when they are rejecting a vaccine about why. You can say you handed out all of the flyers and you did all that you thought you could do, but maybe people didn't actually speak to the local communities. And that involvement, which we heard echoed in the Zambia video, is critical. And one of the examples that always sticks with me that Heidi mentioned was, I think it was in Nigeria, that it was rejection of the vaccine, and finally someone went back and talked to them, and it was linked to the fact that the boxes from USAID were marked sterile. And no one had chosen to engage with them about why they would fear sterilization after that. So sometimes it seems basic, but you have to talk to communities, and they have to be engaged in the effort.
I mean, just to add to that point, I would just say that, Gavi and many other organizations work closely with CSOs for that very reason. I mean, they can do so much just to help us to go into a community and build that kind of credibility, so.
Great. Well, I'd just like to take a second to thank the panel for their time and for their valuable insights and their videos.